Good morning, dear students. Here we are in the second class of studying anatomy together. In the previous presentation, that is Study Anatomy Part 1, we have studied about the sub-branches of anatomy, methods to study anatomy. And now, anatomy as a subject of your first professional MBBS course, we have to proceed with the next part, where we will cover in this presentation the relative and descriptive terms in anatomy and the different terminologies. Now, why we need to know the terminology? First of all, these terminology used specifically in anatomy, and it will be used by you lifelong as medical students. And we will say every structures or the relationship of one structure to other, or the adjacent structure, or the structures lying far away from one another, in reference to some terms. And these terms are only used in anatomy. So we will first proceed to mainly the gross anatomy part. And here the several terms that is used in anatomy region-wise. As we have already said, for the gross anatomy study of the cadaver, we have to divide the whole body into 5 regions: head, neck, thorax, abdomen, superior extremity, and inferior extremity. And the basic structure of these parts, that is the formative bones, muscles, joints, nerves, and vessels, and lymphatics, so also other structures. Now, while encountering any structure in anatomy, during dissection, one must be aware of its position and its relative relation to surrounding other structures, all in reference to the anatomical position. Now, the term anatomical position is new to us. So, what do you mean by anatomical position? Now, see, when a person, male or female, is standing erect, okay, straight away, with feet together, eyes looking forward, arms by the side of the body, where the palms will look in front. Okay, so this is the anatomical position. And get it registered in your mind very carefully that we will read any of the structure in relationship to the anatomical position. For dissection of the cadavers, mainly in the front side, we have to keep the body at supine position onto the dissection table. Now, what the supine position is meant? This is an anatomical term. Okay. The word supine has come from the Latin word supinus, means one lying on its back. Okay, on its back. You can see that the cadaver is being kept on the table in this way. And the reverse of the supine is the prone position, when the body of the cadaver lies face down. Okay, so that the back part of the body can be dissected and can be seen. Now, as per different particular other sort of dissection that we want onto the cadavers, we may have to move it sideways. With the side that is touching onto table or the dissection table is right side, then it is the right lateral decubitus, or right lateral position. And this is the left lateral decubitus when the body of the cadaver or the living person is lying onto its left side. So for better understanding of the structures, we should dissect the different parts of the body, and the lines of dissection are called the anatomical planes. Now, while the line of dissection is along the center of your body, that is median, Get this word, median. It is the median plane, or it is also known the mid-sagittal plane. Here onto your skull, there is a suture formed between two parietal bone, is known as the sagittal suture, which is said to be at the center of the two halves, right and left halves of your body. So while a plane is crossing through that suture, through and through your body, dividing the whole body into two halves, one right half and one left half. And that plane is known as the median plane or mid-sagittal plane. Now, the same way, when the dissection line passes through, dividing the body into an front half and into an back half. So that plane is known as the coronal plane. Now, when the body is divided severally in small pieces through and through, then it is known as transverse or horizontal plane. The planes are passing horizontally, and these are said to be planes because multiple of such planes may be drawn or may be used to cut the body, one parallel to another. So these are several in number. These may be several in number passing through different regions parallel, okay, horizontally, and these are the several transverse or horizontal planes. For again little bit more understanding, you can see this is the sagittal plane. The blue one is the coronal plane. The green one is one transverse plane. But definitely for better understanding, or as if the body we want to see can be cut via several planes going through parallel to the transverse plane. So these are the transverse planes and parallel to the median plane also. So the parallel to the median plane, if we cut the body, then the plane is paramedian. Okay, that may be on the right side, that may be on the left side also. So this is paramedian or parasagittal plane. It may be multiple. They may proceed on to the right side or left side of the body. So this way, the coronal plane, several more planes may be drawn or may be used to cut the body parallel to the coronal plane too. Now, we have to study the different terminology that we will use lifelong. First is anterior and posterior. Anterior opposite is posterior. Anterior, in other words, said as ventral. Posterior, other word says as dorsal. So anterior is the front side. Posterior is the back side. Front side is a layman word. In medical science or while studying anatomy and other subjects, we have to say anterior or ventral. And the back part or the posterior part or the dorsal part is opposite to the anterior. Now, suppose we want to locate a structure, that is the abdomen. So we will say the abdomen is anterior to the back, or the nose is anterior to the ear. Now see that both are placed in front, we can see, but nose is more in front. So that is more anterior. And if you will compare these two structure that is nose and the ear, one is lying in more front, one is lying in more back. So the structure that is lying in front, that is the nose, is anterior to the ear. Or in reverse word, we can say the ear is posterior to the nose. Like that. These are the surface features, so I am giving the examples. Now coming to the medial and lateral. Now in the previous slide, we have said of a plane that is placed onto sharp in the middle of our body, and this is dividing the whole body into two halves, one right and one left. Now, any structure lying close to this median plane is medial to the structures that is lying away from the median plane. Suppose if I am saying of the right half of the body, that is the part on the right of the median plane. So what I will say? I will say that the shoulder is lateral to the neck. Okay, we can say this. The shoulder is lateral to the neck. Or again, I can say that the navel is medial to the arm. The navel is medial to the arm. Okay, or we can say the nipple is medial to the arm. Reverse way, the arm is lateral to the nipple. Clear? Now coming on to superior and inferior. Superior has synonym known as rostral or cranial. In the next slide you will see. And inferior again having the synonym of being caudal. So now coming on to the term that is superior or inferior, a structure on the upper part of the body is superior or cranial or rostral. A structure in the lower part of the body compared to the previous is inferior or caudal. Okay, now we will say the head is rostral to the abdomen, but the foot is caudal to the abdomen. We can even say that the knee is caudal to the hip joint, right? So this is superior and inferior combination. Now say on to this superior is being said, cephalic or rostral. These are the other synonyms, caudal for the inferior one. Now in case of these two terms, that is proximal and distal. Proximal and distal again one opposite to other in relationship. The proximal and distal is the word used for placement of a structure close or away from the center of the body. A structure that is close to the center of the body is more proximal than the structure lying away from the body. At the center position of our chest, there is the location of the heart. Okay, so a structure close to the heart is more proximal or is proximal, okay, to the other structure that is lying away from them. Suppose we are saying of a structure that is elbow joint is more proximal than the wrist joint. Or the reverse way, the wrist joint is distal to the elbow joint. Understood? Now, next term is, again, it is a combination term. One reverse of other. Ipsilateral or homolateral and contralateral. Now, ipsilateral means features lying onto one half of the body. I have already said that the body can be divided equally into two halves, right and left via the median plane. So a feature or more than one feature lying onto the same half is known as the ipsilateral or homolateral. And if the features are present at one part to the one half and another part to the other half, then the features is said to be contralateral in location. Suppose a person is having paralysis, mainly neurological disorder, there is development of weakness or even paralysis. The loss of the functions of the muscles, nerves, and all this because of some neurological disorders he will learn afterwards. So if the person is developing weakness onto the right upper limb, okay, along with the right lower limb, so we will say the person is having paralysis on the ipsilateral side of superior and inferior extremities, or the person is having paralysis on the ipsilateral side or having the ipsilateral paralysis on the right side of the body, okay, involving the upper limb and the lower limb. Now imagine a clinical situation where the paralysis is on the right superior extremity or the upper limb, along with the left lower limb. Then we will say the feature is contralateral. That is, the person is having paralysis on the right upper limb along with the left lower limb. That is the reverse side of the median plane. So the feature of paralysis here is contralateral. Okay. Again, the one pair of more term is superficial and deep. Try to learn this word in pair, one reverse of other, one compared to other. Okay, thus it will be easy. So superficial and deep are the terms used in relationship of any structure lying close to the body surface. Now, a structure close to the body surface is more superficial. The structures going away from the body surface is more deep.
Suppose we are doing dissection of any part of the body. Region wise, we are doing dissection of the superior extremity or the upper limb. Then we will proceed from the skin side to going underneath. So the skin is superficial to the other structure. If you will see layer wise, after the skin you will get different fascias, then bone, muscles, nerves along with the other structures. So the structures which are nearer to the skin is superficial to the structures that is lying deep to.
Again, another pair of term is interior and exterior.
And to say about interior and exterior, our body having cavities inside, that is the thoracic cavity and the abdominal cavity, some structure, some organ lying inside it, and we have a covering of skin and fascia muscles onto the exterior. Okay, so the skin is on the outer or the exterior side and the organs are lying inside or interior to the skin.
Again, these two terms in combination, one is invagination and exvagination. You know, the invagination means something is going in from outside, that is invagination, and exvagination is something is coming out from inside. You have probably been able to see some of the persons having, where mainly hernia cases, you can see that some person is having a swelling of something coming out from the body cavity to the exterior. Okay, so that is one structures meant to lie somewhere and it is coming outside. That is exvagination. Same way, some structures is meant to lie some outside region and it is going inside. So that is invagination. Okay. Now to say about the terminologies of anatomy, these are the few we have touched. Read in groups: anterior, ventral, posterior, dorsal, medial, lateral. Median is single, only one plane, has no its opposite and etc. Then superior, inferior, cranial caudal, proximal, distal, ipsilateral, contralateral, superficial, deep, supine, prone are the positions, interior, exterior, invagination and exvagination. These are the terms we will use very frequently, and you have to remember while studying any part or any viscera or any bone or any structure in the body. Of the competences, this is a must know region. And several other terminologies will be related to a particular relationship, such as bones, muscles, movements, joints, and other structures. So in the next presentation, as we are proceeding with the gross anatomy part, we will say of the terminologies related to the bones and their surfaces features. So this is the end of this presentation. While learning anything from any of the online videos, my dear students, please take it as reference, because the basic details of any structure are in your textbook. Take any of the standard textbooks. Even if you learn anything from the online videos, correlate it with your book, because our memory is very volatile and The subject is itself new with lots of new terminologies. So whenever you hear something from any of the presentation of mine or anyone, always read once from the book, okay, of the consequent subject, because the presentation is like a cinema. It will get flushed away from your mind within few times. But if it is compiled with your vision, your own senses of your studying, your own textbooks, so that will be a permanent memory and a long-term memory. Okay, so remember my words. Whenever you're learning anything from any online site, must correlate and revise from your standard textbook. Okay, so good luck. Goodbye. We will see in the next class along with the terminologies related to bones. Goodbye. Best of luck.